It's 2025 and it's the time to update your skills on how to prepare for your OSCE examinations for the CMTO registration exams. So if you're ready, let's get started. My name is Steph Massage Therapist and welcome to the third video of all the OSCE free course that I'm giving for OSCE preparation to help you pass. Okay, we need good RMTs. We need you in our field. A lot of people can benefit if you become a great massage therapist. But the first step to do that is pass the exams. Yeah, so we're gonna do that. Basically, for today, we're gonna talk about station 3 and 4. It's kind of long, so I want you to go down the description box below, get the CMTO candidate handbook from Prometric of 2024. Again, they didn't update their website yet as when I'm uploading this video, but if they upload the new one, I would put it on my link below. So what I'm gonna be doing is I'm gonna be just reading first the things that you need to do and in station 3 and 4, and I will be explaining to you the study techniques right away because it's a bit complicated, but not so much. So for station 1, the candidate is expected to perform specific assessment techniques. A list of tasks is provided to the candidate that includes a combination of palpations, range of motion, assessment, muscle strength, length test, and neurological and orthopedic test. The candidate may perform these tasks in any order, as the tasks are not intended to form a cohesive massage therapy assessment. The client is healthy and will not portray positive test results. Tasks that occur on a limb may be performed unilaterally. The candidate will have access to equipment including a reflex hammer, cotton balls, spin wheels. The client is dressed in shorts and tank top, and they will not consent to removing articles of clothing. The client has already given informed consent to the assessment, including written consent when appropriate, so that the candidate can proceed with the required tasks. Now, hear me out. Again, these might change, but the format will not change. Remember that assessment 1 is a list of tests. Okay? Remember that. Now I'm going to read assessment 2. It'll be long. I'm going to read it. Assessment 2, station 4. In this station, the candidate is expected to conduct thorough assessment of the client by choosing and performing assessment techniques relevant to the health history and assessment findings provided. The assessment should include a variety of special tests, range of motion, palpations, to determine the cause of the client, and palpations to determine the cause of the client's symptoms and exclude other possible causes. Gait and standing postural assessments are not required. Generally, assessments that are performed on a limb can be performed unilaterally for the purpose of OSCE. The client will not respond to questions about information provided on the STEM, for example, the health history findings, because it's not the time for that. But the client will respond with positive test results when assessments provoke symptoms to cause pain. The client will respond to questions about their responses to assessments, and the candidate should communicate their suspected clinical impression to the client. The candidate will have access to the equipment such as reflex hammer, cotton balls, and pinwheels if required. The client is dressed in shorts and tank top, and they will not consent to removing articles of clothing. The client has already given informed consent for the assessment, including written consent when appropriate, so the candidate can proceed with the required tasks. So, basically, what it says is that assessment 2 is an actual assessment. Yes, that's what they're asking you for. So, for assessment 1, the best way is to still organize the way you present things. So you don't blabber there. You know, you don't like, "Ah, I don't know what to say, blah, blah, blah." Simple. Always say the purpose, explain, do the test, then result. Some RMTs might say, no, it's not needed kind of thing, but to be honest, this has helped a lot of my students to actually just be organized. The purpose of this carpal tunnel test is, the purpose of valence test is that it's testing for carpal tunnel. So let me explain how you're gonna do it. I'm gonna let you point this bone to this bone together like this and tell me if you feel pain here. So now you're performing the test. Perfect. Now, because you did the test, the result of this one is that if you have pain here and numbness and tingling down the arm, it means you're positive. But then if you didn't feel it, it's negative. You see how it works? It's clean. Okay? The best way to study for this one is to obviously familiarize the purpose, explain, do the test, and result. Long story short, the best way to study for assessment 1 is to learn how the test is properly performed. Do you understand? And if you study this way, assessment 2 would be easy. Hear me out. Because in assessment 2, you are going to do an actual assessment. You will pick the test. Are you with me in this? It's you. You will pick the test. So nothing is given to you. I mean, there is, which is the scenario, but you, based on that scenario, you will pick. It's you. So now, here's the thing. If you do not know the test's purpose, how to explain it, how to perform it, and what's the result, then how can you pick a test? Are you getting what I'm saying with this? Are you getting what I'm saying with this? Yeah? 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 Yes? Perfect. So, my study method for this one is learn the tests, group them together like what we did in REMEX. If you didn't watch the REMEX one, the link is here, but do it like you did in remedial exercises. Group muscles together. Group all the tests that would be positive for valence test. Group all the tests that would be positive for facet joint irritation. Group all the tests that will be positive for tendonitis. Group all the tests that would be positive for thoracic outlet syndrome. Okay, why? Because once you group them together, the symptoms will be the same. So technically, if that symptoms showed as the result, then it means that's the right thing for it. That's the right test for it. So group all tests together, know how to perform them step by step, and match them with and perform the test accordingly. That's assessment 1. Now, if you did study assessment 1 properly, assessment 2 would become a little bit easier. Do you understand? Do you understand? Do you understand? Yes, you do. Because again, you cannot pick a test when you don't know the choices. And yes, you can still pick names and choices, but the problem is, how can you proceed? Yeah, you pick the test, but how can you proceed if you don't know what's the purpose, how to explain it, how to do the test, and what's the result? How can you find the clinical impression that they are looking for at assessment 2 if you don't study for assessment 1? That's why I combine them together. Unfortunately, there might be other RMTs there that can give a better option of how to study for assessment 1, but this has been the most effective method that I've done. Grouping all tests together, making sure I know how to perform each test accordingly. Not just the special orthopedic test, even the posture test. I mean, that's not needed there. But But the range of motion test, I know the purpose, I know how to explain, I know how to do the test, every single one of them, and I know the results that I should be expecting. Dermatomes, myotomes, those things, I know all of those. Okay? That's why learning and organizing your notes using these 4 things would help you group the muscles together so that once you group it, you can mix and match it once you do assessment 2. That's the easiest way of how can I explain to you how to study for this. What's hard for this one is the application on assessment 2. Okay? And that's what I'm going to show you next for this one. So, let me explain. So let's assume that you are familiar with all the tests, you know the origin, not origin. Yeah, you know the origin, insertion of stuff. By the way, that method that I said that group things together in Remax, it works with origin insertion too. Because if you know where the common origins are and where you have the common insertions would be, so on and so forth, then you'll get it. Okay? So, how would I pick the right test? Okay, I'm just going to give you a brief example of how I would navigate it. So I would give you one for range of motion. So I have active range of motion, passive range of motion, and then active resisted range of motion. Usually, if the patient is positive or having pain or active, it's talking about muscles and joints and tendons. So very generic. If the patient is experiencing pain on passive, then it's going to be ligaments, mainly. And then if it's active range of motion, it's the muscle strength. And it's important that you understand this because it will help you pick a test for next. Because if they are positive with active and negative with these things, it means the special orthopedic tests that you're gonna pick should be related to the muscle, joints, and tendons. If, let's say this is negative but this is positive, it means instead of looking for a muscle and joint tendon test or a muscle strength test, this is what you're gonna look for, a ligament test. You know what I mean? Active, that's the normal thing. It means there's already body weight in that. That's why muscle, joints, and tendons are affected. Passive range of motions are ligaments. You as a therapist would move the patient, right? Active, patient would move on their own. Passive, the therapist would move the joint for the patient. You moving the joint for the patient is actually you mimicking the muscle's job. So that's why you're isolating the joint, the ligaments itself, and of course putting resistance. That's why it's called active resistant. The person will do the action, okay, and then the person will do the action, and then you would resist it to see for muscle strength. Okay, so that's how I would use range of motion accordingly to figure out which special orthopedic test would make sense. Okay, it doesn't mean it's in the shoulder. I'm gonna give everything. I'm going to use that if nothing's coming up on my brain. But if I know all the tests and I group them together based on pathology, based on signs and symptoms, it would be easier for me to cater which range of motion will it be. Okay? So yes, we have range of motion. Now let's proceed to the dermatomes, myotomes. So we have neurological also. Dermatomes, myotomes, and deep tendon reflexes. Myotomes is for motor innervation. So basically, weakness. Okay, by the way, all of these 3 things are neurological. So you can only use this when appropriate, meaning to say, if it's showing you a neurological problem, then definitely go for this one, right? Then we have dermatomes for sensory innervation. So if your patient is feeling like sensory deficits, then it would be dermatomes. Deep tendon reflexes are for reflexes. Okay? So if your patient complains about weakness, then use myotomes. If the patient is feeling sensory issues, okay, then you use sensory innervations. And then if patient's reflexes are having issues, then you're gonna use DTR. Okay? Again, doing the myotomes, dermatomes, and DTR, I would say is nice to learn because, again, it's gonna help you determine where the problem is. Is it a muscle thing or is it a sensory thing? Capiche? Now, in terms of special orthopedic tests, it's gonna be the same. Okay? This is my study hack for you. Once you have combined all special orthopedic tests that matches the pathology, okay, that matches the pathology, I want you to only use that when the STEM tells you about a specific sign and symptom. Okay? So, example. For this one, I'm going to give an example. For example, let's say carpal tunnel. I'm going to pick a test under carpal tunnel. Phalanx and reverse phalanx. Right? I know what carpal tunnel signs and symptoms are. So if I see that on the STEM or in a patient, I'm going to do these tests. That's what I need. So let's say supraspinatus tendonitis. Okay? Let's say for supraspinatus tendonitis, I would say I'm going to do empty can, drop arm, Neer's test, and let's say that's it for now that I remember. So every time that I see signs and symptoms of supraspinatus tendonitis, these tests is what I'm going to be performing. What am I trying to tell you? What I'm trying to tell you is that once you group all pathology together and then put all the special orthopedic tests that would be positive on that pathology, it would be easier to find a test. Because you understand the pathology. For carpal tunnel, you understand what's the signs and symptoms. If it matches the signs and symptoms or the positive results of phalanx and reverse phalanx, I'm going to do this. Do you understand my point? Group the tests according to pathology and you will see the difference. Do you understand? Do you? Yes? Perfect. Again, these are too big to just explain in a crash course, but we can help in honing it down. So my best suggestion is always group muscles, always group the tests, always group things that are similar, and notify yourself of the odd one out. Because if you know how, like if you organize your thoughts like that, it would be easier to find the test. It would be easier to perform things, if you know what I mean, right? There's a lot more that we can tell you, and that's why we would love to invite you in our community. The link would be in the description below. I want you to join the thing, and if you do have any questions about this episode for today, you can always ask me on Instagram or through the group. I would definitely give you an answer. This is the best way I can help you if you join Facebook group and the private community group that I have. I am offering live FAQ sessions starting February, or if it's already February, it's probably started already, and we will give you more practice example of the station 3 and 4 that you can do at home. the way we do these sessions will be explained in the session below. So it's gonna be our welcoming orientation for you once you join the group, and I hope to see you there. So again, my tips for this one is that group your things together, understand the differences of each assessment. I know this video is not too long because again, there's a lot of things to consider, but the study skills and the strategy are there. Okay? And there's so much that I can say, but we need more practice. We need more application for this. And my setup right now doesn't really show that. And that's what we want anyway. So, again, if you do have any questions, check our description box. Welcome to the community. My name is Steph, massage therapist. Don't forget to like, share, comment, and subscribe for more videos. And ciao! Bye!